12 Destructive Daily Habits Harming Your Kidneys. Situated in our lower back like silent guardians, the kidneys' bean-shaped organs play a crucial role in upholding our overall well-being. Despite their often overlooked presence, these organs tirelessly work to filter waste, maintain electrolyte balance, and regulate blood pressure. Regrettably, our daily habits can significantly jeopardize their health, leading to enduring damage. The decisions we make in our lifestyle, ranging from the foods we consume to our water intake, wield considerable influence on our kidneys' well-being. Recognizing and adjusting these habits could prove essential in safeguarding kidney health and averting the onset of chronic kidney disease. Let's delve into and explore 12 common routines that can adversely affect the health of your kidneys. In today's video, we'll unravel how each practice takes a toll on these vital organs. Always be sure to consult with your doctor if you have any concerns regarding your kidney health. Now, let's begin. 1. Inadequate water intake. The kidneys play a pivotal role in filtering and expelling waste products from the bloodstream. When dehydration occurs, the blood volume decreases, and waste concentration rises. This heightened concentration poses challenges for the kidneys, hindering their efficient filtration and resulting in the accumulation of substances in the body. This scenario may elevate the risk of kidney stones and other kidney-related issues. Moreover, dehydration can trigger muscle breakdown, releasing a protein called myoglobin into the bloodstream. While the kidneys normally filter out myoglobin, excessive amounts can lead to deposits in kidney tissues, causing inflammation and damage. A study involving 12 healthy adults explored the influence of hydration on renal function. Participants adhered to both a low hydration regimen, half a milliliter per kilogram of body weight, and a high hydration dietary plan, 4 milliliters per kilogram of body weight every alternate 30 minutes. The findings revealed that higher hydration levels decreased the glomerular filtration rate, a crucial indicator of kidney filtering efficiency, and increased sodium excretion. 2. Excessive use of painkillers. Painkillers often serve as a relief during challenging times, yet their overuse can pose risks to the kidneys, particularly when consumed in large quantities or over an extended period. Such medications may diminish blood flow to the kidneys, impairing their optimal functioning. A recent study, spanning over 14 years and involving more than 11,000 initially healthy men aged 40 to 84, delved into this issue. The findings indicated that men who reported taking 2,500 or more analgesic pills, equivalent to 3 or 4 pills a week, did not exhibit a higher likelihood of displaying signs of renal damage compared to those who rarely or never used such painkillers. However, caution is essential, as exceeding this limit may potentially harm the kidneys if taken without appropriate precautions. 3. Excessive salt consumption. An overabundance of salt in the diet can pose challenges for the kidneys, hindering their ability to eliminate fluid, resulting in fluid retention and elevated blood pressure. The heightened blood pressure, in turn, stiffens and narrows blood vessels, diminishing the flow of blood and oxygen to vital organs. This prolonged condition may cause damage to the filtering units of the kidneys, leading to scarring and impairing their capacity to regulate fluid. High salt intake significantly influences kidney function by altering glomerular hemodynamics, the process through which the kidneys filter blood. These effects are particularly worrisome in populations with high salt sensitivity, such as the elderly, obese individuals, and those with diabetes, where the risk of kidney damage and disease progression is notably increased. To mitigate these risks, experts recommend adopting a low-sodium diet, ideally not exceeding 1,500 mg per day for most adults. This dietary approach aids in managing blood pressure and alleviating the strain on the kidneys. 4. Excessive alcohol consumption. Before you reach for another drink at the party, keep in mind that alcohol has the potential to disrupt kidney function, diminishing their efficiency in filtering blood. Persistent alcohol consumption may also contribute to liver disease, placing additional strain on the kidneys. Liver disease disrupts the crucial balance of blood flow to the kidneys, essential for proper filtration. This simultaneous dysfunction of both organs is particularly noticeable in individuals with alcohol dependence. Several studies suggest that alcohol intake can elevate oxidative stress, leading to an excessive production of free radicals. These radicals, in turn, induce tissue injury and heightened inflammation, ultimately promoting dysfunction in kidney performance. 5. Excessive smoking. Smoking poses a threat to kidney health as it can interfere with medications used to manage high blood pressure, a leading cause of kidney disease. Additionally, smoking slows down blood flow to vital organs. This diminished blood flow compromises the kidney's ability to carry out essential functions, such as effectively filtering waste from the blood and maintaining fluid balance in the body. A 4-year study involving approximately 200 patients delved into the impact of smoking on chronic kidney disease. The findings revealed a significant elevation in the risk of chronic kidney disease among smokers. Current smokers exhibited a higher risk compared to non-smokers, particularly those with a substantial cumulative smoking history. The risk was most prominent in cases of hypertensive nephropathy and diabetic nephropathy. 6. Excessive caffeine intake. While many of us enjoy our morning coffees, it's essential to be aware that excessive coffee consumption may be detrimental to your kidneys. In quantities surpassing 3 cups per day, coffee intake can elevate potassium levels. An 8-ounce cup of black coffee contains 116 milligrams of potassium, and the addition of creamers or milk further amplifies this content. Although potassium is crucial for kidney and muscle function as an electrolyte, excessive levels can jeopardize these mechanisms, putting our bodies at risk. A study involving over 5,800 overweight or obese elderly individuals with metabolic syndrome investigated the impact of caffeine on kidney health. The findings revealed that consuming more than 2 cups of caffeinated coffee or at least 1 cup of tea daily resulted in a greater decline in kidney function over a year compared to those who consumed less. 7. High sugar diet. Our dietary choices can significantly influence our health, especially when it comes to vital organs like the kidneys. Carelessness in this regard may lead to negative consequences. Sugar, particularly fructose, is theorized to be a potential cause of kidney disease. Elevated sugar intake is associated with various risk factors, including heightened serum uric acid levels, diabetes, and obesity, all of which may collectively contribute to kidney damage. For diabetic individuals, excessive sugar consumption poses a particular risk to kidney health. After 15 years of living with the disease, approximately 1/3 of diabetic patients displayed signs of microalbuminuria, a condition characterized by increased albumin presence in the urine. Furthermore, less than half of them developed true nephropathy, a condition affecting kidney functions. Monitoring sugar intake is crucial for safeguarding your health. As per the American Heart Association, men are advised to limit their added sugar intake to no more than 9 teaspoons, equivalent to around 36 grams or 150 calories per day. For women, the recommended limit is 6 teaspoons, translating to 25 grams or 100 calories per day. 8. Neglecting nature's call. Prolonged retention of urine can potentially lead to kidney damage through a condition known as hydronephrosis. When urine cannot flow from the kidney to the bladder, increased pressure and swelling in the kidney may occur. This prolonged pressure can result in reduced kidney function and, in severe cases, permanent kidney damage. Without appropriate intervention, severe hydronephrosis may progress to kidney failure, necessitating treatments such as dialysis or a kidney transplant. A study involving over 100 female nurses, often prone to delaying urination due to extended working hours, revealed that those who consistently avoided bathroom breaks experienced an enlargement in their bladder capacity. However, over time, retaining a substantial amount of urine may weaken pelvic floor muscles, making it more challenging to control the urge to urinate. 9. Eating processed foods. When it comes to the management of kidney health, diet is an extremely important factor. Because of the high degree of dependence that people have on processed foods, you should be aware that a diet that is high in processed foods may cause leaky gut syndrome, which in turn raises the risk of kidney disease development. Processed foods cause dangerous chemical compounds and known as advanced glycation end products, which are partially to blame for this. These products activate the body's danger signals, leading to an inflammatory response and chronic kidney disease. A study, which included over 14,000 adults, found that ultra-processed foods are associated with a higher risk of chronic kidney disease. The end result reported a 24% higher risk of kidney issues in people who consumed the most ultra-processed foods compared to those with the lowest consumption. Each additional serving of ultra-processed foods was associated with a 5% higher risk of the disease. 10. Lack of adequate sleep. The sleep-wake cycle plays a crucial role in coordinating the daily workload of the kidneys. Inadequate sleep disrupts the secretion of melatonin, a hormone that regulates nocturnal functions and has implications for kidney health. Sleep deprivation has been associated with health issues such as hypertension, diabetes, and obesity, all of which contribute to a decline in the glomerular filtration rate, a key indicator of kidney health. Numerous studies have found that over 50% of patients with end-stage renal disease also experience sleep apnea, a condition characterized by interrupted breathing during sleep. This prevalence is significantly higher than in the general population. 11. Low physical activity. This is commonly associated with weight management, but its significance extends beyond, impacting chronic kidney disease indirectly. Obesity, often linked to conditions like fatty liver disease, can lead to fat deposits around organs, including the kidneys, causing inflammation and scarring that impairs kidney function. Additionally, a lack of physical activity may result in hyperlipidemia, characterized by elevated levels of fats like cholesterol and triglycerides in the blood. These fats have the potential to accumulate and inflict damage on the kidneys, either directly or indirectly through associated cardiovascular diseases. A study comprising 12 randomized controlled trials involving chronic kidney disease patients demonstrated that regular aerobic exercise significantly improved key indicators of kidney health. Notably, aerobic sessions exceeding 30 minutes had a more profound impact on the filtration rate. Exercise forms like walking and running proved especially effective in enhancing serum creatinine levels. 12. Excessive meat consumption. Meats are abundant in sulfur-containing amino acids, metabolized into sulfuric acid, thereby increasing the body's acid load. Prolonged exposure to high acid loads may result in metabolic acidosis, a condition that can potentially lead to kidney damage over time. Furthermore, many types of meat contain elevated levels of oxalates, known contributors to the formation of kidney stones, particularly calcium oxalate stones. These stones have the potential to obstruct urinary pathways, causing pain and elevating the risk of kidney damage or infection. In a study involving approximately 4,900 participants, the association between various protein sources and the risk of developing chronic kidney disease was investigated. Individuals with the highest consumption of total red meat and processed meat had 73% and 99% higher odds of developing chronic kidney disease, respectively. Interestingly, replacing one serving of red or processed meat with low-fat dairy, nuts, whole grains, or legumes was found to reduce the risk of chronic kidney disease. As you become familiar with the harmful habits that can pose risks to your kidneys, protecting them becomes a more manageable task. Understanding the importance of an optimal kidney-friendly diet is essential for early prevention and effective management of potential complications. It's crucial to be informed about foods that promote kidney health, typically characterized by low levels of sodium, potassium, and phosphorus, along with a richness in antioxidants and beneficial nutrients. It's crucial to remember that a small change in daily habits and incorporating suitable dietary changes can significantly impact kidney health. Individual dietary needs may vary, so it's always best to consult with a healthcare provider or a dietitian to tailor food choices to individual health needs, especially when managing kidney health. Did you find the video informative? If yes, please subscribe to the channel, like and share for more health topics. Thank you.